Hey, thank you so much for watching Real Health Talk, and my name is Arafat Mugabo. Today we are discussing on hydrocephalus, and in the studio I'm joined by Dr. John Baptist Nkuranga from King Faisal Hospital, and Dr. Nkuranga is a neonatologist and director of maternal, child and women's health at King Faisal Hospital. He's here with us today to give us his expertise in the area of hydrocephalus, because he works with children, mothers, and all other related issues. So you're most welcome, Dr. John Baptist.
Thank you, Arafat, for having me on your show, Real Health Talk.
Wow, that's great. Doctor, start by giving us an overview of what hydrocephalus is.
Hydrocephalus is just, the word as you say, is abnormal accumulation of those things that the baby is born with. It's a congenital anomaly that the baby is born with an obstruction along the path of where the fluid that is produced in the head goes through. But also others are, the children can, or even the adults can develop hydrocephalus later as a complication to another condition that affects the child's brain. So you can either be born with it or it can come. But the end point is that there is abnormal or an obstruction to the flow of the fluid that is produced into our brain. Just a very quick clarification is that the brain sits within the skull, which is the head. So the strong bone structure, so the brain sits within there. But God makes it in a sense that there is water or fluid that covers the brain, so that the brain do not cause friction on that bony part. So that's the way it does. So that fluid that covers the brain and protects the brain is produced inside the brain and then flows out of the brain and goes around the brain tissue outside, as much as it continues into the spinal cord, into the back, and still it's the same mechanism. It protects the brain tissue that goes down to the spinal cord. So one of that way where that fluid is produced and its normal flow out of the brain, or any obstruction at that level, then that fluid doesn't have where to go because it is continuously produced, and then the head cannot accommodate it. It starts down, the head starts growing bigger and bigger, and that's what we see from the layman's language. We see a very huge head. We see a child with a very huge head. Coming back to you, and the children, because their brain, their skull, the head bone is still open with what we call the fontanelles, the one that the deeper, soft part of the head on the head of the babies, because that is still open, and other sutures are still open for the children, especially for the young newborns up to the age of almost 2 years. Those ones, once the fluid accumulates, the head starts growing because there is space and room for the head to grow and to expand. If it is an adult, that's not possible because the adult, the head is already sealed off, so it can't expand. Rather, we see people coming with different signs, signifying that fluid has been accumulated and it's causing pressure into the brain.
It really disturbs me when I find mothers on the street trying to beg, using those kids with big heads, that they are bewitched, because this condition is really people try to use it as if it's out of witchcraft. Some people say that this is due to witchcraft and all that, but medically, what exactly happens in the head for the fluid to accumulate, for the head to expand?
Well, Arafat, I think that's a key point, I think, to our viewers, the take-home message is that it has nothing to do with witchcraft. This is a very easy mechanical problem. It's just that if you have fluid flowing in a direction and then you stop that fluid from flowing in the normal way, then this fluid starts accumulating. But because you cannot turn off the tap that produces this fluid, then the fluid continues to accumulate continuously. And that's what makes the head continuing to grow and to grow whatever they do that. So it's not witchcraft, it's a very clear medical condition that we know very well. And I advise anybody who sees that mother, to really advocate taking the child to the health care facility so that they can figure out what is the cause. So that's one. Regarding the cause, as I mentioned, some babies they are born with it, in a sense that there was an error during the formation of the brain, and one of the pathways was blocked, so it did not open as it should have opened up to give space for that fluid to go, and that's what we call the congenital. So it is an error in the formation of the brain of the child or before the newborn. But also they will have conditions that I mentioned that comes after the baby was born. For example, you may suffer from meningitis, severe form of meningitis, and because meningitis is an inflammation, the brain tissue is inflamed and destroyed. So even the pathway where the other fluid used to pass is blocked because of the distortion of the brain tissue, and that way the fluid can accumulate. And because we see it mainly in babies who are born preterm or their due time, especially those who are born very early. But the problem is that it's because those who are born early or preterm, the blood tissue that is bred into smaller holes where that fluid is produced and where it flows into, then the blood blocks the outlets, the ways where that fluid usually used to pass. That's the blood tissue from breathing. The head continues to grow because the other fluid can pass. So there are a number of things that happens to the brain that can cause that problem, but the take-home message is that there is a condition, whether you're born with or whether it comes later, that blocks the normal pathway for that fluid to pass and then starts accumulating. Yeah.
Wow, that's great. So if you are to list it out, what are the main causes that someone watching Real Health Talk will take home, and what are the main causes of hydrocephalus, if you're to list them?
So the majority of them, there are a number of things, but from these many causes, we are taking out the congenital. That means that's how it was an error of your brain, the way your brain was formed, and you have nothing to do with it. It's difficult. Born very early, it's quite high risk. It can cause bleeding into your ventricles. Preterm birth, yes. You can breathe. The preterm baby can breathe into the head, and breathing can obstruct the airway and cause the problem. I mentioned infection, especially meningitis to be specific, can be a cause of that. And then I want to say the tumors, the brain tumors or cancers. When I say tumors, it's those swelling into the brain that also comes from nowhere. Many of them can be sporadic. Also, that anything that obstructs the pathways for that fluid can be caused. So those are main. There are quite a number of causes, but those are main causes that we see.
Wow, that means the defect itself, or the enlargement of the head starts immediately. To those that are born with it, it is noticed immediately after birth. And if you are to give us that clearly, what is the real size of the head? What is the real size of the normal head, that if at least if I give birth to this kid at home, or maybe in the hospital where the doctor have not noticed it, how can I measure that to know that the head of my kid is normal?
Yeah, thank you, Arafat. I don't think really it's a useful information to tell the viewers to measure and the stress. What I can say is very important. The question you asked, and so we investigate why it is large. or it's normal, so we have no concerns. And sometimes we can have the opposite. We can have an abnormally small head. So the take-home message is really the point. Your question is relevant in a sense that saying that a normal range is around 35 centimeters, it will not help anybody. And looking at your head, mine and somebody's, we have some variations on our head size. I think the best way is if you are born, if you deliver, make sure you do it in a health facility. And if you're born home, rush to the health facility for your baby to be assessed. The initial assessment is to rule out any obvious, visible malformation that we can do. And then from there, they can help you. If that was done and you are worried that your child's head looks bigger than you think, especially it looks bigger when you compare with his or her siblings, it looks bigger when you compare with the mom's or the daddy's head. Our children are proportionate to our size and proportionate to the things we have. So if for that reason you think the head it looks bigger than you would expect or compared, then it's safer to go to the health facility. Now they can do actual measurements because they know how to measure it appropriately, and then they can help you.
Well, thank you so much for watching. Still, we are looking at hydrocephalus with our expert in the studio. But please remember, as you've heard the doctor saying, the doctors say that you always have to ensure that you give birth from your hospital so that the experts, the doctors, can do all that measurement before you leave the hospital, so that they know whether the head of your child is normal or abnormal, because you yourself, you can not easily detect it from home. So please, we are closing from here and we are coming back exactly what are the complications that may arise, and looking at also the treatment side of it next time when we come back. Thank you for watching. Still, we are at Real Health Talk.